So what has been the investment from the hospital partner side into the Medical Legal Partnership of Southern Illinois from 2002 to 2012 was about $400,000. So let's look how that translates to these arguments of return on investment. The first thing that you always want to do is meet your obligation as it relates to financial return on investment. So if your investor, in this case the hospital system, gives you $400,000 and you could come back to them and say, beyond that $400,000 that you gave me, I've made you $900,000. Well, that's an amazing case, and why I'm interested in issues of social entrepreneurship or venture philanthropy is because this helps you as well as other people. We now have that funder that has more resources to continue your program as well as help other people. So we've met our return on investment goals. So for every dollar I was given, I give $3 back. But we don't want to be greedy. We don't want to just have this to be a financial transaction between a hospital system and them getting money back. So how could we look at how people are helped? How people are helped is through an example here of patient debt relief. So beyond the money that goes back to the hospital, what we're interested in is how are people helped. And so people with amazing amounts of debt burden that may otherwise suffer from medical bankruptcies, as we heard earlier in the day, have millions of dollars of debt wiped away. And it's beyond just medical bankruptcies for people who've experienced debt. You have people calling you. They want their money back. And one thing we know in the healthcare world now, especially in hospital systems, is that that money that's left on the table will not be left there in the way it was in the past, that they're going to become more aggressive at people to collect debts. So we could protect people in this way. Another great thing about legal aid is that we can look at that investment again and we could say, if you went to the private market, what is the value of that purchase service? So if you purchased private attorney time relative to the cost point for legal aid, what I know is that that purchase price for the legal aid person is much more efficient than it is for the person in private practice. So we're gaining more value because the cost of the service that's offered is lower than it is in the private market. We can also make cases from simple data collection on economic development. So we could look at things like Social Security benefits that return to the community. And we could say this hospital is helping the economy of this impoverished community. We're bringing money from the outside in the total of $2 million thanks to this investment. So here are just a few examples, and there are other examples of how this works. But the important part is that we can show a diversified social return on investment. So what this translates to, and this is a vast underestimate of the actual, but it's the data that we have in hand, is that the social return on investment from that $400,000 is approximately $10 million. So over 2,000%, over 2,300% return on investment for that system. We know this is an underestimate because, like anything, when you're just starting out, you miss data. But we can extrapolate from that. We also know that there's data that's been collected we haven't included in these calculations, things like food benefits, child support, which we're now going to add. And these are all on that same dollar value scale. We could be in a position where we've provided services, for example, if we're interested in housing and asthma, where we may not have the dollar amount of what that service translates to, but we can estimate it. So here's an example. We know that if we do mold abatement in a home, the average person, the cost that's avoided in a given year is about $500. Our patients are probably more high risk, so it's probably closer to $1,000 for each person. So what that means to me is that our social return on investment through MLPSI is probably closer, when we include everything, to 4,000%. That's a remarkable business case when we're looking at an investment.